Hello, my name is Tyler Silvey. I am a first semester nursing student at Lincoln University. It's April 5th, 2016, and it's 11:45. Today I will be demonstrating how to give an enema. So I have checked my physician's orders for the type of enema that I'll be giving. I've assessed my patient, their need for one, their bowel function, things of that nature. I have assessed their their mobility, whether I'll be able to get them on a bedside commode, a bedpan, what will be best for them, and their cognitive function, because if somebody has poor cognitive function and you go to stick an enema, they're going to be going crazy on you. So for time purposes, I've already prepared most of my stuff, but I've got the correct type of enema that I will be giving my patient. I will fill it with 500 to 1,000 mils of warm water, not cold, not hot, the perfect temperature. I've primed my tubing into a trash can or a sink without touching the tip onto anything, just to get all the air out of the line. There goes my tip. It would stay on in real world. So I will enter my patient's room, introduce myself. Hello, my name is Tyler. I'm going to be giving an enema today to help with your constipation. I would do 2 patient identifiers, perform privacy. For time purposes, I've already placed my patient left laterally. Got a bath blanket here to provide a little bit of privacy, and I've put a chuck down to help with any mess that may occur from the enema. At this time, I would explain the procedure, answer any questions or concern that the patient may have. So I'd go ahead, I'd perform hand hygiene, and I'd put on a clean pair of gloves. Once I've done that, I would take my enema and I would lubricate the tip, the good amount of lubricant, so it's not painful, roughly 3 to 4 inches. I will then go ahead and tell the patient I'm going to touch them, so I would lift the buttocks, insert the enema 3 to 4 inches towards the umbilicus. I would then take my bag, and I would lower it, take my clamp off, and I would then slowly raise the enema 12 to 18 inches above the patient's hip. If the patient was in pain and couldn't tolerate it, I could lower it, clamp my enema, wait 30 seconds, and then try it again. But in our case, my patient has already used up all of the fluid in their enema bag, so I would clamp it, hang it back up. I grab a disposable paper towel. I would tell the patient to relax. I'm going to be taking the enema out. So I would slowly pull it out, place the tip in the paper towel, throw away my enema. I would then take my gloves off and perform hand hygiene. I would instruct the patient to hold the fluid in, to try and hold it in for 5 to 15 minutes, depending on the type of solution that's instilled. I would place my call light within reach so my patient's comfortable, and then whenever it's time, between that 5 to 15 minutes where they can no longer hold it, I would come in, assist my patient to the bathroom. Once I did that, I would record all pertinent data regarding the stool, the time and the date the enema was placed. Then I would place my patient back in their bed. I would lower the bed down to the ground because I have it in working position right now with the side rails turned up. Call light within reach, make sure they're comfortable, and good to go.